In the name of God, the most compassionate, the merciful. Hello, I'm Dr. Tahir Ali Zamir, the Assistant Professor of Anatomical Sciences from Hamadan University of Medical Sciences. And in this presentation, I want to continue about the nervous system. Uh, in the spinal nerves, we have 31 pairs nerve fibers which they're classified on the basis of their location in different subgroups. The first one is cervical nerves. In the cervix or in the cervical region, we have 8 pairs of spinal nerves. Then in the thoracic part, we can see 12 pairs. In the lumbar region, we can see 5 pairs. And the segments for the sacral nerves are 5, and they are below the lumbar region. And after that we can see coccygeal nerve, which it is 1. There are 2 points, or there are 2 notes. First of all is the number of the nerve fibers depending on the bone number of the vertebral column. I will speak and discuss about this. And after that, I want to speak about the longitudinal, or about the length of the spinal cord in comparison to the vertebral column. In the embryologic stage, as I said in the last presentation, the length of the spinal cord is according to the length of the the height of the vertebral column. But more and more, whenever we can see the proliferation and developmental stage of the fetus and embryo, the differences between these 2 parts, the bony structures of the vertebral column and the spinal cord, can be dominant, and these differences become more and more because we can see the mitosis very much in the nervous system, but on the other hand, in the bone tissue we can see this. So the size and the height of the vertebral column, which is from the bone tissue, become more and more, while the spinal cord size are fixed. And by this fact we can see that the differences between these 2 height taking place. The main question can be produced, and it is, we say that, for example, the sacral nerve is on the basis of the number of the bones in the sacrum are 5. But as I told you, can tell me and ask me, you told us the end of, or the terminal part of the spinal cord in an adult person is in L1. So how can it taking place? How can we understand these 2 facts? I tell you, when I say that for example, the sacral nerve fibers, like the sacral bone vertebra, are 5, before the birthing, it means that the segment of the spinal cord in lower portion is related to the sacral fibers, but it doesn't mean they are overlap with the sacral bony structure. No, because you know that the terminal end of the spinal cord in an adult person is L1. So for this fact, because the fibers, for example, of the lumbar nerves or the sacral nerves or coccygeal nerves wants to goes from their own foramen, they become in lower portion, and after receiving to their own foramen and their own segment, they pass and goes away from the vertebral column. And for this fact, let's see, for this fact we can see that let me we can see that in the termination of the spinal cord we have some fibers which their direction are perpendicular, because they want to reach to their own foramen, and after that they want to pass. But the termination of the spinal cord is here. It was the first note about the spinal nerves, but the next one is that in the spinal nerves we have a fact, and it is on the basis of the number of the vertebral bones in the vertebral column we have the spinal pair nerves. But how it can take place? Because there a difference there is a difference between the number of the vertebral column bones and the nerve fibers in the spinal nerves. As you know, or as I said, the number of the spinal nerves is 31, but the number of the vertebral bone in the vertebral column is 33. So there is a difference, and maybe we be mixed up. You told teacher that they are overlap with each other. So please explain us how can it taking place. Okay, I will tell you. It refers to the fact, and that is, in the cervical part we had 7 vertebral bone. Okay, when the fibers of spinal nerves wants to pass from their own intervertebral foramen for exiting from the spinal cord, in this part the fibers pass and exit from above of their own segment. So the C1 segment for spinal nerves goes from the spine, the intervertebral foramen between C1 and inferior aspect of the skull. So by this fact, when we receive to C7, for the C7, the fibers, the nerve fibers of spinal nerves pass and exit from above of the C7 segment. So between the C7 and T1 segment, the free space is remaining. Why? Because the fibers for the thoracic segment exiting from the intervertebral foramen below of their own segment. So when the T1 to T12 and of course L1 to L5 and etc. Pass from the intervertebral foramen below of their own segment, so the free space between T1 and C8 is remaining, and for this fact, because there is the free space, we can see the fibers of spinal nerve in this part is generating and passing from this position and location. So without considering this, we can see, and of course without considering this one, which I will tell you and explain about this also, we can see that the number of the nerve fibers are very are matched and has a relation have relation with the number of the bones in each region in vertebral column. So we can see the 12 pair nerve fibers in the thoracic part, and of course in the lumbar region it's 5, because the number of the bone vertebral um, um, column, I mean the bones of the vertebral column here are 5, and for the sacral is 5. Why it becomes 5? Because it refers to the embryologic stage, not in adult processing, not in growing, because at the first stage of the development we had 5 segments for producing the sacrum, so the number of the fibers of the spinal nerves for this location, for this portion, depending on this fact, becomes 5. But why, in contrast of the number of the bones in the coccygeal region are 4, why we have just one pair spinal nerves here? Because the fibers of the nerve here in the coccygeal region fuse to each other and become one, because they are very thin, and the region which they innervate them or innervated is very very short, so they fuse to each other and become one. And by this fact, while we have 4 bone in the coccygeal region, just we can see 1 pair nerve fibers here. It was the explanation about the numbers and why we say that it is 31. As I told you in the last presentation, I said that in some regions in the spinal nerves, spinal cord, we have some enlargements. One of them is in cervical part, and the other is in lumbar portion. This enlargements refer to having the plexus. For some part of the body which they need to have a complexity or have a more complex innervation and have a fine movement, we can see the plexus. One of them is from above to below. The first one is cervical plexus. The cervical plexus region or origin, the cervical plexus origin is from C1 to C4, and they match and they fuse to each other, and after having a relation with together and each other, some fibers produced and innervate a definite region. For example, in the cervical plexus we have a nerve which its name is phrenic nerve. It originates from C4, C3 also, and it innervated diaphragm. So for having innervation by more definity, we can have a plexus. It is the cervical plexus and their relation with each other for innervating some parts of the cervix. For example, for innervating the muscles of the cervical region, as you see. The next plexus is brachial plexus. The brachial plexus is originate from C5 to T1. I mean that some fibers from T1 is coming to the cervical part and taking a part for making the plexus, which its name is brachial plexus. The main duty for brachial plexus is innervating the upper limb muscles and structures here. At the end of the brachial plexus, we can see some fibers, some nerves, which they have different names. For example, musculocutaneous, or median or radial or ulnar, for innervating different parts and muscles of upper limb. Just knowing these facts is sufficient for this semester, I think. The next one is lumbar plexus. The lumbar plexus is originate from L1 to L4. Maybe you ask yourself, so how about the L5? I will discuss about this next. So the lumbar plexus, also like the brachial or cervical plexus, has some relation between the neighbor fibers, and after that we can see some main nerves like femoral or obturator nerve for innervating the lower limb portion. Here. And the last one is sacral plexus. The sacral plexus is originate from L1, L4 to S4. So L5 is participating in this plexus, and the main nerve which is originate from this plexus is sciatic. The sciatic, which is the most thickness nerve, is originate from the sacral plexus in the sacral region. Okay, after speaking about the peripheral nervous system, I mean the spinal and cranial nerves, let's see about the autonomic nervous system. The autonomic nervous system, which in some references classified as peripheral nervous system, has two subgroups. One of them is parasympathetic, and the next one is sympathetic system. But there is a fact about the parasympathetic and also about the sympathetic system, and it is we can see in all portion or all over the brain and spinal cord both of them. No, in the brain we can't see any portion of sympathetic system, just in the spinal cord and in the regions between T1 to L2 we can see the sympathetic chains and sympathetic fibers, efferent and afferent. So there isn't any center or any organization for the sympathetic system in the brain, so pay attention about this fact. And in contrast, parasympathetic system are organized in two portions or in two centers, one of them in the brain and the other in the spinal cord. In the brain, in the fibers for the third, 7, 9 and 10, for the in the nucleus of these four cranial nerves we can see some centers for parasympathetic system. But besides this part, we can as you see, for example, the 3 which is it goes to the eye, or in 7 it goes to the glands of submandibular or sublingual, the 9 for the parotid gland, and of course for the vagus to going to the toward the to go toward the heart, the lungs, the digestive system also. Some part it shows that the parasympathetic system in cranial portion organized and conduct these parts about the system of parasympathetic. But another center is existing in the lower portion of the sacral segment in the spinal cord, and it refers to the S1 to S4 for controlling and managing the messages from the urinary system and lower portion of the digestive system also. And on the other hand, sympathetic system, it can control and have a contrast or unlike function in comparison to the parasympathetic system, as you see for the centers like this one. At the end of the nervous system, I want to speak about the meninges. Meninges of the brain are some layers which supports and cover and nourish the brain and also the spinal cord. So let's see about their its classification and the name of these layers. The meninges has three portions or three layers. One of them is dura mater, the next one is arachnoid, and the last one is pia mater. The dura mater here is a fibrous, dense connective tissue, which in some portions, which it has two layers, and in some portions the layers they separate from each other and make an empty space, which they are the location for the venous sinuses. On the basis of their neighboring by the bones, we call them, or on the basis of their direction, we name these venous sinuses in different names. For example, we call it superior sagittal sinus because it is in below the sagittal suture, and because we have two sagittal sinus, we call it superior sagittal. Okay, let's back to the layers of the meninges. The dura mater so has two layers, one of them attached to the bony structure and the other attached to the arachnoid. The arachnoid is the second layer. Below the arachnoid we can see, it is the arachnoid, and below this we can see the space which we call it subarachnoid space. In this space we have the CSF or cerebrospinal fluid, and it has very important function for gathering the viruses and any infection, and have a balance, make a balance for the brain and for nutrition and etc. And after that we can see the pia mater. The pia mater attached to the parenchyma of the brain, so it has contains the blood vessels, in contrast to the arachnoid. In arachnoid we can't see any blood vessels here, and it is very thin. Pia mater is very thin layer which support and connects to the parenchyma of the brain. Thank you.